Hello everyone, this is Maimuna Fatima from Jipulla Reddy College of Pharmacy, Hyderabad, India. Today I am going to present a research work entitled Formulation and Evaluation of Famotidine Pulsatile Tablets using Core in Cup method. These are the contents of my presentation. Pulsatile drug delivery is defined as a rapid and transient release of certain amount of molecules within a short time period immediately after a predetermined lag time. The systems may also deliver the drug rapidly and completely after a lag time. This pattern of release is known as pulsatile release. It is time and site-specific drug delivery which provides spatial and temporal delivery which ensures patient compliance. It basically delivers the drug to the right place at right time and at right amounts. It is used to treat diseases showing chronological behavior, treat patients suffering from chronic problems such as arthritis, asthma, hypertension. This graph shows the drug release from pulsatile drug delivery system, wherein drug release as a pulse after a lag time, or there is a rapid and complete delivery of drug after lag time, or a constant drug release after a prolonged period following the lag time. Coming to the core in cup tablets, these are inlay tablets capable of providing zero order drug release. They are basically disc-shaped matrix core which is compression coated on one surface and at the circumference to form a cup around the core. The drug release takes place in a sustained manner from this. In general, gastric acid secretions follow a circadian rhythm with a sudden surge of gastric acidity when the gastric pH levels is less than 4 for at least 1 hour in midnight. This pathophysiological condition is known as nocturnal acid breakthrough. It is seen that by the addition of bedtime dose of H2 antagonists to the evening dose of proton pump inhibitors provides a nocturnal recovery of the gastric acid secretions. In case of nocturnal acid breakthrough, chronotherapeutic approach can also be used, which ensures that the highest blood levels of drug coincides with the peak symptoms in the early morning hours. Here, a bedtime dosing of H2 antagonists in pulsatile drug delivery system combines with a normal twice a day proton pump inhibitors is used. Famotidine is a H2 receptor antagonist which belongs to PCS class 4. It binds competitively to the H2 receptor and blocks histamine effect, resulting in reduced basal and nocturnal gastric acid secretions and reduction in the gastric volume, acidity, and the amount of gastric acid released in response to a stimuli. When famotidine is administered in the form of pulsatile drug delivery system at bedtime, the drug release takes place after few hours, that is in the morning hours, which is ideal in case of nocturnal acid breakthrough. Coming to the aim and objective, the aim of the present work is to design a floating pulsatile drug delivery of famotidine by core in cup system, which ensures a sustained release of drug from the cup followed by an immediate release of the drug from the core. For this purpose, the following materials are used. Coming to experimental methodology, calibration curve of famotidine was generated in 0.1 normal HCl and the lambda max was determined for 30 micrograms per ml standard solution of famotidine, which was found to be 267 nanometers. Standard graph was plotted in the linearity range of 5 to 30 micrograms per ml. Then the drug excipient compatibility studies were carried out using FTIR. Potassium bromide pellet technique was used and the resultant spectrum was observed for the presence of characteristic peaks of the functional group and compared for presence of any spectral changes. Coming to the preparation of core tablets, the core tablets were prepared by using the direct compression technique. 6 mm punch was used and different polymers and the effervescent materials were used for the preparation. For this, famotidine and other excipients were individually sieved using the 60 sieve 60, and then this was thoroughly mixed. All the ingredients were thoroughly mixed for 15 minutes. The obtained powder blend was lubricated using the magnesium stearate and subjected to compression. For the core tablets, preliminary tests were carried out using different ratios of the gas generating agent, then using different polymers, then with HPMC K4M in different concentrations and sodium bicarbonate as gas generating agent. In all the three cases, the powder blend is compressed using 60 mm punch and it was checked for floating. This is the table for formulation of core tablets where different percentage of HPMC K4M was used. Here compression was done using the 60 mm punch. Then the prepared tablets were evaluated. Following is the list of pre-compression and post-compression evaluation tests that was carried out on the core tablets. Coming to the preparation of core and cup tablets, ethyl cellulose was used as an impermeable cup and xanthan gum and HPMC K4M as hydrophilic top layer. Here the optimized core tablet was subjected to press coating using the 10 punch. Basically, ethyl cellulose, that is 60 mg, was filled into the die cavity and compacted to make a powder bed. Then the core tablet was placed in the center, and around the surroundings, remaining quantity of ethyl cellulose was added. Then on the top, hydrophilic soluble polymer is placed, and it was compressed to get core and cup tablets. This is the formulation table of the core and cup tablets, and these are the prepared tablets. The prepared tablets were evaluated for various parameters which are listed as shown. Coming to results and discussion, lambda max of 267 nanometers was obtained for famotidine in 0.1 normal HCl, and the standard graph was plotted in the linearity range of 0 to 30 micrograms per ml. FTIR of the pure drug and the physical mixture of the drug with the excipients was carried, and there is no significant changes in the spectra indicating that the excipients are compatible with the drug. From the preliminary trials, HPMC K4 showed formulation showed excellent floating properties, and this was selected for preparing the core tablets. Formulation with different percentage of HPMC K4M was prepared, and this was evaluated, the results of which are as shown. Then from the in vitro buoyancy studies, it was found that formulation containing 40% HPMC K4M showed floating for 3 years. So this was selected for preparation of core and cup tablets. Then the core and cup tablets were prepared and evaluated. It can be seen that with the increase in the concentration of HPMC K4M, the lag time increases and the drug release decreases. From the dissolution studies, formulation F4 was selected as optimized formulation, and it successfully showed a lag time of around 4.2 hours. Then model dependent kinetics was performed to determine the release kinetics, release mechanism, and the drug transport mechanism. It was found that the optimized formulation follows zero order drug release kinetics, Crossmeyer-Pepper's drug release mechanism, and from the values of N, it was found that the formulation shows anomalous transport drug release mechanism, the drug release process being swelling controlled. This is the plots of the model dependent kinetics for the optimized formulation. Coming to conclusion, nocturnal acid breakthrough occurs in the midnight, and conventional drug delivery systems are inappropriate for delivery of famotidine. Hence, oral pulsatile release dosage forms possessing gastric retention capabilities was designed so that it can be given at the bedtime and the drug release is seen in the morning. For preparing core and cup tablets, ethyl cellulose was selected as cup, HPMC K4M as hydrophilic plug layer, and sodium bicarbonate as a gas generating agent. Then the optimized formulation was evaluated for various parameters. It showed a lag time of 4.2 hours. In vitro studies of this showed the lower initial release after the lag time, and 83% drug release was seen at the end of 7th hour. Then model dependent kinetics studies indicated that F4 follows zero order drug release kinetics, Crossmeyer-Pepper's drug release mechanism, and based on the N value, the release mechanism was identified as anomalous transport, the release process being swelling control. Coming to the future scope, pharmacokinetic studies need to be performed for the formulations. These are some of the references. Then I would like to thank the organizing committee of ICOPS for giving us this opportunity to present our work. Thank you. Thank you, everyone.